Do you know how the fetal head undergoes changes in shape when it passes through the constricted birth passages during labor? Or why babies have soft spots on their head that later disappear? These adaptations are facilitated by the presence of suture and fontanelles in the fetal skull. In this video, we will explore the fetal skull, its bones, suture, fontanelles, and many more things. Let's begin by understanding the different bones that form the fetal skull. Frontal bone. The frontal bone forms the forehead and the upper part of the eye socket. In the fetus, it is divided into two halves, separated by the metopic suture, which later fuse around 2 to 3 years of age. So, in a newborn, the frontal bone is still in two parts, which helps the skull to mold during birth. Parietal bone. These are two large curved bones forming most of the vault of the skull. They meet at the sagittal suture in the midline and join the frontal and occipital bones via coronal and lambdoidal suture respectively. We can think of the parietal bones as the main roof of the fetal skull. Occipital bone forms the back and base of the skull. It is roughly triangular in shape in the fetus and has a large opening called the foramen magnum for the spinal cord. It joins to parietal bones at the lambdoid suture and contributes to the posterior fontanelle. Temporal bone found on either side of the fetal skull below the parietal bones. They contain the structure of the ear and part of the base of the skull. It joined to the parietal bones by the squamous suture. Sphenoid bone. It is a butterfly-shaped bone that forms part of the fetal skull. It connects with almost all of the cranial bones. Ethmoid bone. A small, light bone located in front of the sphenoid and behind the nasal bones. Forms parts of the nasal septum and eye socket. It is not visible externally. Now that we know the bones, let's divide the skull into different regions. Vault. It is formed by two parietal bones, upper part of the occipital bone, the temporal and frontal bones. It is large, dome-shaped uppermost compressible part of the fetal skull. Base. It is formed by sphenoid, ethmoid and part of the temporal and occipital bone. It is the lowest part that provides protection to vital centers in the medulla. Face. It is formed by small bones in front like maxilla, mandible, nasal, etc. It is the area from roof of the nose to the junction of the chin and neck. Vertex. It is bounded anteriorly by bregma and coronal suture, posteriorly the lambda and lambdoid suture, and laterally lines passing through the parietal eminence. It is quadrangular in shape. Occiput. It is an area from posterior fontanelle to the foramen magnum. Synciput or brow. It is mainly composed of the frontal bone, bounded the orbital region in front and to coronal suture behind. Now we learn about sutures and fontanelles. Sutures are fibrous joints that connect the bones of the skull. In newborns, these sutures are flexible and allow the skull bone to separate slightly, which is crucial for the brain's rapid growth and for the head to change shape as it passes through the constricted birth canal. There are mainly four types of sutures. Frontal suture. It lies between two frontal bones. It is also known as metopic suture. Coronal suture runs between parietal and frontal bones on either side. Sagittal or longitudinal suture. It lies between two parietal bones. Lambdoid suture. It separates the occipital bone and the two parietal bones. Now comes fontanelles. Fontanelles are the wide gap in the suture line. These are non-ossified membrane face of the fetal skull formed from the union of two or more sutures. There are total 6 fontanelles, but only 2 are of obstetric significance. These are anterior fontanelle or bregma and posterior fontanelle or lambda. Anterior fontanelle or bregma is formed by joining of the four suture in the midline. These are anteriorly frontal suture, posteriorly sagittal suture, laterally or either side there is coronal suture. It is diamond shaped. It is ossified about 9 to 18 months of age. Anterior fontanelles had greater importance because through internal examination, its palpation denotes the degree of flexion of head. It facilitates molding of the head. Palpation of the floor reflects intracranial status, which is depressed in dehydration and elevated in rest intracranial stress. During palpation, the anterior fontanelle should feel soft. Fontanelle should not be sunken or bulging. During percussion of fontanelle, if there is dull cracked pot sound, then it may suggest increased ICP or intracranial pressure. Now we learn in short about the posterior fontanelle or lambda. It is formed by the junction of three suture lines. Anteriorly sagittal suture and laterally or either side there is lambdoid suture. It is triangular shaped. It is ossified about 3 months of age. So till now we have discussed basic anatomy of the fetal skull, its different bones, different regions, suture and fontanelles. But this is not the end. In the next video, we will learn about the diameter of the fetal skull and important condition like craniosynostosis. So thank you for watching this video and see you soon in the next video.